Welcome to Engineer Abdullah Baqshan Research Chair for Growth Factors and Bone Regeneration, King Saud University, Riyadh, Saudi Arabia. Civil society's progress grows faster than their infrastructure, economic, and social systems to reach knowledge maturity as we're entering the age of globalization. Therefore, the leadership of the kingdom, under the directives of the custodian of the two holy mosques, King Abdullah bin Abdulaziz, followed strategic policies in knowledge production and participation in globalization activities by settling research studies and institutional investigation, which guides the state developmental strategies before its outputs. In this respect, His Excellency Dr. Abdullah Al-Uthman, the University Chancellor, and Engineer Abdullah Ahmed Baqshan signed in May 2009 a research chair agreement on growth factors and bone regeneration in the field of dentistry to be a quality thumbprint for Saudi knowledge, although the chair is newly established.
رأينا اليوم ليس فقط الشراكات المحلية مع المجتمع ولكن أيضا الشراكات العالمية، وهذا أيضا مؤشر آخر للنجاحات التي حققتها الجامعات السعودية من خلال بناء هذه البنى التحتية البشرية والمادية خلال
أنا أؤكد لكم أن هذا الكرسي يمثل نموذج من النماذج المشرفة في الكراسي البحثية بجامعة الملك سعود، وهو كرسي المهندس عبد الله بن أحمد بقشان للأسنان.
هذا سوف يخدم إن شاء الله كثير بالنسبة للحوادث والأورام. المعروف الحوادث عندنا في المملكة العربية السعودية كثيرة تنفق عليها البلايين، لكن إن شاء الله هذا الكرسي سوف يكون له دور إن شاء الله.
Excelled in bringing the latest technical equipments of international standards to promote the level of researches of clinical and preclinical applications and to emphasize the importance of investment in developing Saudi specialists.
Welcome to Engineer Abdullah Baqshan, Research Chair for Growth Factors and Bone Regeneration. Road traffic accident in Kingdom Saudi Arabia is the number one cause of death in the Gulf region, and the idea of this research chair to implement using the growth factors to treat those patients who became handicapped or semi-handicapped after road traffic accidents. The vision of this research chair is to have a very unique research center about the growth factors and bone regeneration in the Kingdom of Saudi Arabia. And the mission of this research center is to have this research is very competitive to the state of the world and the state of the art and the research.
The chair location consists of two fully equipped operation rooms to satisfy the standards of OSHA organization related to place sterilization, in addition to the readiness for live transmission of surgical operations performed in the chair location. The chair is technically distinguished by its CT scan lab of nanotechnology, which is the only one of its kind and the largest in the world. The chair also succeeded in attracting the best prominent scientists to participate in performing their required roles. Those scientists include the following. Dr. Myron Nevins, Research Chair Professor. Dr. Myron Nevins is well known globally for his valuable contributions in translational and clinical research. Dr. Nevins is an Associate Professor of Periodontology at the Harvard School of Dental Medicine, Clinical Professor of Periodontology at the Temple University School of Dentistry, Adjunct Professor of Periodontics at the University of North Carolina, and is a consultant to the Bethesda Naval Hospital. Dr. Nevins is also the editor of the International Journal of Periodontics and Restorative Dentistry, the herald of all journals. Dr. Nevins is the former president of the American Academy of Periodontology and a former director and chairman of the American Board of Periodontology, where his contributions have been recognized with the Gold Medal and Master Clinician Awards from the American Academy of Periodontology. Local and international clinicians and researchers in all fields of dentistry recognize Dr. Nevins' focus on translational research that has benefit to the patient and impacts people's lives and improves the quality and standard of care. Dr. Khalid Al-Hazemi, Research Chair Chairman, graduated from the College of Dentistry at King Saud University in Riyadh, Saudi Arabia in the year 1999. Dr. Al-Hazemi is an Assistant Professor at the Department of Periodontology, College of Dentistry, King Saud University. Dr. Al-Hazemi served in the Board of Trustees in the Anti-Smoking Society in the year 1999 until 2001. He is an endodontist, periodontist, and a researcher. Dr. Al-Hazemi is a Fellow of the Royal College of Dentistry in Canada and a diplomat of the American Board of Periodontology. Presently, Dr. Al-Hazemi is the chairman of the Engineer Abdullah Baqshan Research Chair for Growth Factors and Bone Regeneration. Dr. Khalid Al-Hazemi is also adjunct clinical professor at the University of Southern California and Tufts University. Dr. Al-Hazemi has written chapters in textbooks and published numerous papas in international journals in both fields of endodontics and periodontics. Professor Hom Lai Wong, Research Chair Advisors. Dr. Homlai Wong is a director and diplomat of the American Board of Periodontology, a former president of the Midwest Society of Periodontology, a former consultant for the ADA Commission on Dental Accreditation, and a president-elect, board director of the International Congress of Oral Implantologists and a fellow of American College of Dentists. He serves as an editor-in-chief for the Open Dentistry Journal, an associate editor for the International Journal of Oral and Maxillofacial Implants, International Chinese Journal of Dentistry, and assistant editor for the Implant Dentistry, editorial board member for the Journal of Periodontology, Clinical Oral Implants Research, International Journal of Periodontics and Restorative Dentistry, Journal of Clinical Periodontology, European Journal of Dentistry, and many others. Dr. Wong is a recipient of numerous awards, including the AADS Clinical Research Fellowship Award in 1992, Best Faculty Award in 2003, the Charles E. English Annual Award in Clinical Science and Techniques in 2004, and Morton L. Perrell Annual Award for Dental Implant Educator in 2007. Dr. Massimo Simeoni, Research Chair Advisors. Dr. Massimo Simeoni is a professor and chairman of the Department of Periodontology and Implant Restoration at the Dental School of the University of Milan. He achieved a degree of medicine and surgery at the University of Milan in 1979. He is a consultant professor at the University of Parma, scientific secretary, and founder of the Italian Society of Osseointegration, and is also a member of the board of the European Association for Osseointegration. Dr. Simeoni has published several papers, and he is an international lecturer on the topic of osseointegration and guided bone regeneration. Dr. Franklin Tay, Research Chair Advisors. Dr. Franklin Tay is an associate professor of endodontics in the Medical College of Georgia School of Dentistry. Dr. Tay accomplished his doctorate from University of Hong Kong in 1988 and is studying a new nanotechnology technique to extend the longevity of tooth-colored fillings. In addition to building valuable partnerships with international scientific institutions, including Harvard University, Massachusetts Institute of Technology, University of Southern California, Tufts University, Pennsylvania University, Michigan University, and Milan University in Italy.
The engineer Abdullah Baqshan Growth Factors and Bone Regeneration Research Chair is not only committed at performing high quality and international standard research, but also translating the research into clinical practice. Several studies have been performed at this research center on the effect of growth factors on periodontal and skin tissue healing process, as well as periodontal bone healing. These studies have shown that growth factors can massively increase the healing process and at the same time can extensively reduce the costs of the treatment associated with hospitalization of the patients. Road traffic accidents are a major cause of death in the Kingdom of Saudi Arabia, and treatment with growth factors may significantly reduce the costs of hospitalization and may also promote healing.
The engineer Abdullah Baqshan Research Chair for Growth Factors and Bone Regeneration has published landmark papers in various disciplines of dentistry. Recently, researchers at the chair published a study in the Journal of Periodontology showing the miraculous effects of an analgesic on pain control. The study appeared on the journal's website within a week of acceptance. This study showed that the novel drug was effective in controlling post-surgical pain with no observable gastrointestinal effects. This study attracted the attention of the renowned website www.mdlinks.com. The engineer Abdullah Baqshan Research Chair for Growth Factors and Bone Regeneration has produced research publications on the regeneration of pulp and periodontal tissues with emphasis on growth factors. Researchers at the chair have strived to demonstrate successful treatments for buccal bone defects and have successfully introduced a new classification regarding bone remodeling following tooth extractions, extraction socket classification. These studies have been published in the Journal of Endodontics and the International Journal of Periodontics and Restorative Dentistry. The engineer Abdullah Baqshan Research Chair for Growth Factors and Bone Regeneration believes in diversity and shares its knowledge and skills on a national as well as an international level without reservation. The research chair has and still continues to educate and train master's students and generously shares knowledge with them and at the same time continues to learn from their experiences in research. Engineer Abdullah Baqshan Research Chair for Growth Factors and Bone Regeneration has successfully trained 13 masters and 2 PhD candidates. At the Engineer Abdullah Baqshan Research Chair for Growth Factors and Bone Regeneration, the Research Ethics Committee contributes to safeguarding the dignity, rights, safety, and well-being of all actual or potential research participants. One of the main objectives of the Research Ethics Committee is to define the standards required for the professional conduct of all research within the chair. The Research Ethics Committee also aims at achieving the following goals: A. Making research studies better. B. Enhancing study design. C. Enhancing protection of subjects. D. Enhancing researcher reputation. E. More likely to get published in good journals. And F. Increase the likelihood to get funding.
ما يقارب ال4 سنوات توصل علماء سعوديون إلى اكتشاف طبي عالمي جديد للجروح الفموية عبر فيلم لاصق.
الفيلم لاصق تعود فكرته إلى 3 من الزملاء في كلية الصيدلة، بروفيسور إبراهيم سرة، بروفيسور فارس العنزي، الدكتور جمال محروس. طبعا هي مادة مستخرجة من البحر، تستخدم هذه المادة في الأساس نقل أدوية مضادة للفطريات في بعض التخصصات مثل كأمراض العيون أو في النساء والولادة.
فوائد كبيرة يوفرها هذا الفيلم اللاصق خاصة للمرضى الذين لا يستطيعون أخذ مسكنات الألم، فيما تم قبول الورقة العلمية للاكتشاف الجديد في الأكاديمية الأمريكية لعلوم اللثة وزراعة الأسنان.
إلى اكتشاف طريقة لتوصيل مسكن آلام الجروح الفموية عبر فيلم لاصق. الباحثون شاركوا في مؤتمرات محلية وعالمية بورقة علمية حول الاكتشاف الجديد الذي حصل على مراكز متقدمة، وتم قبول الورقة العلمية من منظمات وجمعيات عالمية، ونشرت في الموقع الطبي الأمريكي الشهير ميدلينكس كمرجعية علمية عالمية.
Microcomputed tomography. Micro-CT is an emerging technology with several promising applications in various disciplines of dentistry. Dedicated software quantifies parameters such as bone density, trabecular volume, number and thickness, and information on trabecular connectivity and shape. Through micro-CT analysis, three-dimensional models can be reconstructed from the micro-CT scans, and the models can be rotated to view from any angle or sliced to visualize the internal structure. Micro-CT is non-invasive and non-destructive, and hence can be performed without affecting any subsequent processing of the sample. Prosthodontics. As a means to develop initial implant stability, different implant designs, length, thread features, surface topography, as well as surgical technologies are used to assist the primary stability in poor quality bone. Studies involving the assessment of implant surfaces using micro-CT analysis have shown that alterations in the implant surface topography and surface chemistry may significantly contribute in the osseointegration of dental implants. The adhesive capacities of the various materials used in prosthetic dentistry have also been characterized using micro-CT tools. The micro-CT has several applications: periodontics and implant dentistry. In implant dentistry, it is crucial to evaluate the implant stability and osseointegration in order to achieve a successful treatment outcome. Implant stability is determined by the mechanical properties of the implant, bone interface, and the quality of the fixation between the implant surface and bone. Micro-CT is a non-destructive and precise procedure that allows measurements of trabecular and cortical bone. It can provide a spatial representation of bone formation at the implant surface and the peri-implant region up to a few microns or even better, and can evaluate both qualitative and quantitative morphometry of bone integration about dental implants. Endodontics. With the advent of micro-CT systems, root canal morphology can be non-invasively and specifically investigated. An enormous data regarding the length, shape, and diameter of the root canals can be obtained to achieve a better understanding of the treatment strategy and the outcome of therapy. Slices can be recreated in any plane, and data could be represented as 2- or 3-dimensional images. Internal and external anatomy could be demonstrated simultaneously or separately. Images could be assessed qualitatively and quantitatively. It is also willing to contribute in performing its national mission in solving problems of jawbone atrophy, bone injuries, dermal deformity resulting from traffic accidents, to let millions of people smile.